Cox Flexion Distraction Therapy is a specialized hands-on treatment method to deal with spinal pain and dysfunction. In recent decades, Cox therapy has emerged as one of the safest, most effective, and most widely researched treatment methods for a number of lower back and neck conditions. In this brief video, we'll take a look at what Cox Flexion Distraction Therapy is and how it's so effective in dealing with lower back pain. When we take a look at the basic anatomy of the lower spine, we can see that the lumbar spine consists of a series of block-like bones stacked on top of each other. Each of these bones is essentially connected to each other through a series of soft tissues to form joints, and each of these joints is able to move relative to each other. And it's these joints which makes essentially the spinal column a movable column. Now, under normal circumstances, each of these bones is supposed to and is designed to move, bend, and twist relative to each other. However, it is common for soft tissues around the spine, things like ligaments, joint capsules, or even some of the muscles that surround the spine, to become tight. And if this happens, it will start to affect the normal mobility of the spinal joints. Not only can this lead to symptoms such as pain and stiffness, but it will start to affect the mechanical nature and the movement capacity of the joints of the spine. And when this happens, it can then start to wear out some of the joints. It can have a degradation effect on cartilage and soft tissue, and eventually it's going to lead to pain and dysfunction. And this abnormal movement of the spine and the spinal joints is actually a very common theme across a number of lower back conditions, including conditions that would involve the intervertebral disc, such as a strain or a herniation. It's common with degenerative conditions of the spine, such as spinal stenosis or spinal arthritis. And it's a major component of what we refer to as simple or basic mechanical low back pain. So for this reason, it is really important we have an effective and a safe method to go ahead and treat these conditions and restore proper mobility to the joints of the spine. And this really is where Cox Flexion Distraction comes in. So let's take a look at what Cox Flexion Distraction looks like and how it goes about treating some of these spinal joint dysfunctions. As previously stated, Cox Flexion Distraction Therapy is a specialized hands-on treatment method that's effective for dealing with many cases of lower back pain. This treatment actually uses a specially engineered table in order to gently stretch and move the joints of the spine. So let's take a look at how this works. Essentially what would happen is we would have the patient lying, in most cases, face down on the table, such that their legs are supported by this lower half or lower end of the table. This lower half of the table can then be unlocked and gently moved around. So for example, we would be able to move the table into an up and down or flexion extension motion, into a side-to-side motion for a lateral bending moment or lateral bending motion. And we're actually also able to unlock the table in such a way that we're able to exert a rotational motion on the spine as well. So let's take a look at how this works, or how this would look if we're treating an actual patient. So we would begin with the patient lying face down on the table, and then we would go ahead and unlock the lower end of the table. Now, before we're actually moving the table around like we showed in the last demonstration, we're actually also going to place a hand contact on the actual spine itself. So essentially we're going to go and find which joints are not moving the way they should. And then we'll take a light contact with our hand on the upper bone of the spinal joint, and we're going to take a slight pressure upwards towards the head. And essentially what this is going to do is it's going to stabilize and hold steady the upper bone of the spinal joint that's restricted. Once we do that, we can then gently move the lower half of the table in order to pull and stretch the lower half of the joint. So essentially what we're doing here is we're stabilizing the upper half of the joint here. The table is then moving the lower half of the joint into those directions, into that flexion extension, that lateral motion and rotation. And also, as this is happening, we're able to exert what's called a distraction or a traction movement as well. So the bones of the joint, the bones of the spine would actually be allowed to separate or pull away from each other ever so slightly. And this type of treatment is very effective for disc problems, as it takes some of the pressure off of the intervertebral disc, or in conditions where there's a radiculopathy or a sciatica type component, such as a disc herniation or a stenotic situation where there's pressure on the nerve. As the bones are able to separate, it actually creates some extra space in between those joints where the nerve lives in order to take some pressure off the nerve and help promote the nerve to heal up a little bit. So it can be very effective for those types of cases. So as we're performing treatment, typically what we would do is we would perform each of these stretches and hold it for 4 or 5 seconds and then just gently relax it. And usually we repeat this 4 or 5 times. And as we're doing this, we're able to change or modify the amount of tension, both with our upper treatment hand here and also with the amount of stretch or pull we're exerting with the table in order to make sure we're matching the tolerance of the patient. So for example, with an acute lower back problem that might be very painful with any types of movement, we would be able to use some very light pressure in order to make sure it doesn't exceed the tolerance of the tissue and make sure it's comfortable for the patient. Then as that condition improves, or if we have a condition where it's not quite as sensitive, we would be able to modify our tension and our pressure to create a little bit of a deeper stretch for a little bit of a more effective release of the restricted tissue.